Warren Buffett's kids, Howard, Susie, and Peter, giving Fox Business the dirt on their dad. They spoke to us Friday exclusively here for the 10th annual Fox Business exclusive interview. And his daughter, Susie, said he's mellowed, but your son said that you don't have an email address, Warren. And here we are. You're BFFs with Bill Gates. You don't have an email address.
I sent one email in my life, and it ended up in federal court and on the Wall Street Journal blog. And I mean, and it went to Jeff Rakes, and so I decided to give it up.
That was
I tried it; it didn't work.
That was the reply to Pershing's Bill Ackman, right?
It was a strange one, but of course, yeah. Debbie does emails for me. So. Right. But it's not a bad idea, just like it is to, to give first expressions immediately. I think it's better to have a time delay sometimes on an email.
All right, we're joined by Charlie Munger, Warren's best friend of many, many years and the vice chair of Berkshire Hathaway. Susie said you've mellowed, but neither of you was mellow when the topic of health care came up. Warren, you called health care the tapeworm of American economic competitiveness.
True.
That's a lovely image.
Well, it deserves it. I mean, our health care may be the best in the world, and Bill would know more about that than I would. But the truth is, it's gone from 5% of GDP to 17%, and there's only 100 points in the dollar.
Charlie,
cost.
You took it a step further, and when I was sitting there in the press box, people were either kind of chittery or gasping when you said, we're giving too much chemotherapy to people that are all but dead.
That's right.
Okay.
I'm trying to be popular, as you can tell.
Yeah, playing to the crowd.
Playing to the crowd.
Why do you say that?
Because it's true. It's asinine to pour a lot of chemotherapy into people that are all but dead. Makes them miserable. It costs a lot of money. It does no good for anybody.
What if they want to?
I would say it's not too much to say that it's evil.
Well, let's say, God forbid, something happened and you came down with cancer and you thought you had a couple more good years in you. And they said, no, you're out.
When there's some chance of it working, I would, of course I'd have it. And I would maybe throw the long bomb. But there comes a time when the game is over and then you should stop treating. Well, it's wrong to keep treating to make money after the game is all but over.
You've sat on boards of hospitals, so you have a sense of what's going on. But let's just say we did go to a single payer, which you have predicted will happen. Who would be in charge? I mean, do we really want to let the government decide who lives and who dies, or who gets chemo and who doesn't?
Well, we do it now. I'm basically talking about Medicaid for all. That's hardly a novel idea. We have it in the nursing homes. Anybody can get on Medicaid who will part with all his assets and needs to go to a convalescent home. We have a lot of single-payer medicine now. If you're utterly disabled, you get free Medicare for life. We have a lot of single-payer medicine now.
From what you can tell from the house plan, Charlie, does it cover people with pre-existing conditions?
Well, that's what I hate. How can you say, be in the insurance business, and some guy comes in where you know you're going to get a $10,000 premium and lay out $150,000? How can you ask somebody to do that in the insurance business? It's bonkers. You're running against human nature. It's crazy. In the other countries, like Canada, they have like Medicaid for all.
Okay.
And nobody wants to give it back, and Canada hasn't lost capitalism.